you're gaslighting her through your denial. Yeah, thanks for taking my call. I'm following up on a prior authorization denial for anesthesia services. This is in reference to a fax that I submitted this morning. The patient's scheduled for a uterine biopsy and endometrial sampling. It looks like your company's denied the MAC anesthesia as not medically necessary. Correct. And I understand the denial is based on your standard policy that uterine biopsies are typically considered office procedure, not requiring sedation. Right. So, yeah, I thought maybe it'd be helpful to walk you through the specific clinical picture and point out some things that are in her case. This isn't a routine case. She has a documented history of cervical stenosis. Her cervix has significant scarring from a prior LEEP procedure. Gynecologist has already attempted biopsy once, and that was in office, and was unable to complete it because of the stenosis. Right, the stenosis made cervical dilation impossible without causing extreme and unmanageable pain. You're looking at a patient where the procedure has already failed once in office due to an anatomical barrier. And the clinical determination is that sedation is medically necessary to even access the uterine cavity. And the reviewer still flagged it as routine. Right, I'm seeing on here a secondary note suggesting that she try an oral anti-anxiety prior to repeat office attempt. I have a couple of problems with that. The reviewer's clinical solution for cervical stenosis and anatomical scarring is an anxiety pill. No additional dilation or sedation, an anxiety pill for a structural issue. I need to make sure that I'm documenting this correctly. Your company is denying sedation for a procedure that has already been attempted and failed due to a documented anatomical barrier. And the alternative being offered is medication that does not address the anatomical barrier in any clinical capacity whatsoever. You're gaslighting her on paper and through this denial. I need your name, board certification, specialty, right, of who denied and reviewed this case. Does the reviewer have a clinical background in gynecology or women's health? Because I want that documented in the appeal. Not only is it barbaric, but I think it's completely egregious